Hello, you're all welcome once again to Health Talk with the Irene. I'm going to continue my discussion on management of diabetic foot ulcer. In the previous video, I did say that we have the healable, the maintenance, and the non-healable, and we did discuss the healable. Today, we're going to talk about maintenance, but the question is, how do you know your wound is in the maintenance stage? So this is when you have a wound that has stalled and has not healed over 4 months, or in years you've not seen the wound heal. Then we consider the wound is in the maintenance stage, as it is not a non-healable wound. It can heal, but it's a stalled, and there is a reason why that wound is stalled, and we want to investigate why and then address it if we can. So very important to go talk to your doctor about it, get referrals to see why the wound is not healing. But I advise that you don't wait till week 12 or after 4 months to get this investigation started. You want to get this investigation started at week 4 if you have not seen any decrease in wound size. So if by week 4 you take weekly measurement and you notice that the wound has not reduced in size by week 4, you want to start this investigation right away. So go talk to your doctor and get a vascular assessment done to see if you have good peripheral arterial circulation. If you don't, you go to see your vascular surgeon. They might recommend revascularization for you to help resolve the issue. You also want to see your infectious disease specialist, especially if you are getting recurrence of infections. They can also help with that. And also see your dietitian about a good protein diet. You need a good protein diet to promote healing. So you talk to them about either a diet or a supplement, and also vitamins as well that will help the wound heal, especially vitamin D, vitamin E, zinc. So talk to them. You also want to talk to your wound care specialist about advanced wound therapies, okay, or wound dressings that can help with wound healing. Usually the wound bed preparation, when we're dealing with chronic wounds or maintenance wound, our main goal is to prevent infection and also to control moisture. Okay, so good moisture balance, very important, and infection control. So we go for that with chronic wounds or maintenance wounds. That is our main objective, is to make sure that we control infection and also reduce drainage. You also have the option of exploring other advanced wound therapies, which is we have the negative pressure therapy, which I mentioned, and the hyperbaric oxygen therapy. So that is when they put you in an oxygen chamber and you get 100% oxygen. You breathe in 100% oxygen to get oxygen into your wound if you do not have good oxygenated blood running through to your wound. We do that to help as well. And very important to get an offloading device. So it's either a podiatrist or your wound care specialist can help you with that, okay, to get an offloading device. And the gold standard for offloading device is the total contact cast. So if that is an option for you, I'll say go for it. If you have that in your area, that is something that you want to explore, especially if your wound is underneath your foot. So this will offload the pressure off your foot and help it heal. I've seen wounds that have not healed in years heal in 6 weeks when we put them in a total contact cast. So you want to explore that as well. We have the TCC Easy. That is easy to apply. You get a wound care specialist or a podiatrist to apply that for you. Usually when we put that on, we assess initially 3 to 4 days to see how your wound is doing. We do not put it on wounds that are infected. We make sure that we are clear of infection, and we put that on, we assess it, and then it becomes a weekly dressing change. So we do dressing change weekly, and then we reapply the cast weekly as well. And we have seen a lot of improvement in that. So if that's an option for you, as I said, you want to explore that. I hope this education has helped. You stay tuned and you stay blessed. Bye for now.